A Twin Cities man credits a newly available antiviral pill to treat COVID with keeping him out of the hospital.
I wasn't sure if I was going to be able to pull out of this situation of having COVID. That's how bad it was starting to get.
Jeff Carlson is high risk for severe illness with COVID and met the requirements to get this treatment. He told WCCO's Jennifer Mayerly how it turned his illness around.
Jeff Carlson did his best to avoid COVID. The 61-year-old has type 1 diabetes and is considered high risk. Despite being vaccinated and boosted, he tested positive a week ago.
COVID had hit me like being run over by a truck. It was in a very short period of time, I became significantly ill.
He says he soon couldn't get off the couch. As time went on, he experienced trouble breathing, and an at-home pulse ox showed his oxygen dropping to dangerous levels, and he had a persistent temperature.
At that point in time, I was told by my medical team that I needed to go to the ER.
Knowing how crowded hospitals are, he was determined to ride it out at his Vadnais Heights home. That's when his doctors at mHealth Fairview University of Minnesota Medical Center weighed giving him a newly approved antiviral pill treatment.
After I was done with the second dose, everything started to improve.
Carlson says it was a relief. There are 2 pills from Merck and Pfizer with varying effectiveness to take after testing positive for COVID-19 and within 5 days of symptoms before going to the hospital, designed for the most at risk of being hospitalized or dying.
It is life-changing taking these drugs and coming out from underneath the grip of COVID to getting your life back.
All right, so who's eligible? Right now, supplies are limited. mHealth Fairview reports it's for people over 65, 55 and older with chronic heart or lung disease or pulmonary hypertension, people over 18 who are immunocompromised or with other conditions like diabetes. We have the full list at WCCO.com, and there you'll also find a patient risk calculator. Aaron?
Interesting story. All right. Thank you, Jen.